We're not suffering from a lack of data, we're suffering from a lack of understanding.
We're living in a world now where there's a huge volume of data, almost an excess of data if we think about the wearables that people have, the sleep trackers, the glucose trackers, the access to ad hoc lab testing, and people don't know what to do with this data. It's confusing.
Yeah. I mean, and that's exactly what we're seeing. I mean, we have people coming in with piles and piles, okay, sometimes years, and say, and what has this taught you? And then you have the silence.
Yes.
And say, well, actually, has it made you wiser? Has it made you change your habits? Okay, how has this impacted your health, your lifestyle, or have you understood anything from this? And that's the answer in the main is going to be like, I've got the data, what do I do with it? And how do I make this relevant to me? Is more data better? No, it's relevant data, which is better, isn't it? And that's where I guess we come in, thankfully. So which data do you feel, of all the data points that we can measure now, that has been most useful for us to actually gather from our clients that we can use to start tracking and start influencing?
I think there's clearly some key elements, but it also depends on what the client is presenting from a symptom point of view, because you will get some people that will run and do their own testing to investigate a certain symptom that we know actually they're just going down the wrong path in the first place. We often see it with digestive symptoms and people running food intolerance testing when actually they should be looking at bacterial overgrowth testing. Okay. We have people already measuring their sleep and having done so for many months when actually it's not a sleep quality point of view, it's an obstructive sleep apnea diagnosis that they've missed. So the relevant testing for the symptoms is crucial. But having said that, there clearly is some data that we find offers huge value. We know tracking cardiovascular fitness VO2 max is critical because that correlates very strongly with current and future health. We know that tracking markers related to metabolic function, whether it's insulin that isn't commonly measured when people look at glucose markers or glucose sensors, is a mistake that people often make. We know tracking lean tissue and muscle mass is critical.
And how do people do that? How do they track that? Most people will be saying, I've got some scales, okay, and I've put on weight or I've lost weight. And then we're saying that's not the data point you really want to track.
The weight's almost irrelevant.
Exactly.
Yeah. For a population, there's some use, but for an individual, that data is irrelevant. So we need to break that down and see of that weight, how much of it is fat tissue, how much of it is lean muscle tissue, where is that tissue distributed, because that can have a significant impact depending where it is within the body. So yes, that can be done at home, but often it's done inaccurately on poor quality devices.
Yeah, and that's what we're seeing. We're seeing what we call the skinny fats, isn't it? Okay, they look very slim, but they're actually not overweight in the sense as in weight, but they have got way too much body fat.
Yeah.
So the tracking on its own is relevant if you know what to track.
And if you know how to interpret it. And often it's that the combination and the multi-factorial approach where you're looking at the whole person with relevant different types of testing versus one test, acting on one test or not understanding that test. There's also the danger of the more data and testing you do, the more you disengage someone because they can't relate to it because it becomes overwhelming. And what our job is to focus on what are the key interventions that we can help coach and change behavior on for someone to stick to is part one. And two, what are the key elements that people need to focus on if they maybe had 50 interventions or 50 elements that they need to start working on. No one's going to do 50, but if we say, look, these 2 or 3 are actually going to give you the biggest effort and biggest reward for your symptoms and what you're trying to achieve, the skill and the expertise is knowing which ones to focus on, having chosen the right data in the first place and being able to interpret that data. So really, having all this data is like having a map without a compass. Plenty of information, but no direction.
So nicely said, Johnny.